Okay, double chin. What is, this is the what you want to line out. This is what is too much. And you go, I would like to go a little bit on this one also. And it goes there. And I'm not touching you. We go to the other side. And there. Now I'm going to let. I'm doing different drawings on each side, okay? So I can show you something. Two things here. You can also address this point if you want. Okay? And what are the concerns about this area in kind of technique? Is really what's going on into the face is the arterial, the facial artery. Okay? So, and also the branch of the facial nerve that goes to the mentalis is also the mentalis, sorry, to the mentalis nerve and to the depressors also is also coming through here. So this is one place you have to be careful with technically. Okay?
Where?
There.
In front of the muscle.
Here. Okay? So in planning this, and I'm going to go also a little bit on this side. And on the face, like this is easy to swell. It swells quite easily, this area. I don't use more than one vial. And I almost have 10 by 10. Because from here to there it's already something more. Do you have a ruler there? A scale, please? No. Thank you. If you go from one side to the other one, you got 15. Okay? So, but you can think about two vials. 15 by 8. Okay? So, but be safe. Start with one vial. That's enough because you'll be swelling a lot here. Okay? And also you have to combine with other areas that you want to use. So, traditional what we see is people coming from this side. Make an entry point here. I don't think this, in my hands, with a long needle, will be safe. I prefer to go from the outer border and I fan it like this. And I go from there also and I will fan it like this. And I'll be meeting in the midpoint. This is much easier to do technically and it's much more safe in much more comfortable also for her. Arms. Can you just pull this like this, please, so you have a background? That would be easy to see. She's a strong muscle. She's a big one. Come here, you know? Yeah. Can you contract your arm? Yeah, it's there. Okay. The only thing you got left is this one. So this is what I would like to do, is to go there and also on the back. It's a bigger area. And I will take this out. And where I will go for, I can go from there. I can do like this and like that. Or I can go a little bit, but I was leaving this out. So midway. Okay? The same thing on the other side. Two vials, because this is a little bit more bigger volume. And whether you concentrate more of the vials, distally or proximally. Because this is another thing. This is more thick than this one. Got more fat on that. That's where you're going to put more. I'm hurting you? This is another pencil. Oh, it's here. Thank you. Okay. So I don't need really to make so too many marks or just plan your area and that's it. Okay, thank you. Then another thing about liposuction and chemical lipodissolving or lipolysis is the pharmaceuticals diffuse. So you don't really need to put in every place. Count on diffusion, okay? It's going to reach all the area. Okay, you got 5 mLs. It's not a complete vial with 0.2 of adrenaline, lidocaine.
5 ml you are mixing or is it?
Now, I mix with all vial, but I just have 5 mLs here on the syringe, okay? And that's, I think, what will be enough for her. But if needed, we can put a little bit more. So, yes, can you look to that here? Okay.
Don't make anesthesia on the entry point?
No need. It's a very small gauge. See, it's a very small gauge. Yeah, you got big fat. Okay. The thing is, make a small fold. Okay. It's okay. Mm-hmm. See, I'm too superficial now. So what I do, pick up the fold again and go. Let's go deeper. And now I'm a little bit more deep. Not too deep, you see? It's really easy to get out, okay? So be always... Okay. And one of the good thing about being with the sterile gloves, you can touch the needle because it's so flexible. It tends to go wherever she wants to go. It wants to go. Now I'm a little bit more deep. Okay, so then. And what I want to reach, midline.
Is there any interesting issue or discussion doing it with a stump needle, just like with body injections?
With the cannula, you say?
Yeah, the cannula.
The cannula is not dissecting the plan as we wish. It's just this is cutting through the fat. The other one is moving the fat apart. So this will be easier with that one. That will be the good thing about the cannula.
It should be safe.
It can be more safe. Yeah. Okay, I pull it. It's not on. I'm already on the right plane on my hands, you know. And then I'm going to start injecting retrograde. Okay? And the thing is, I'm not seeing the needle coming out. There's no any groove. Are you feeling something? Mm-hmm. What? Little bit of pain already, yes? When I was injecting, right? Okay, I feel it. It's here. And when you're going in round areas, you can be deep here and be superficial there. So pull it a little bit out, come back, and go again. Okay? Always be really deep. Now I'm not feeling it. When I start to inject, and I inject very, very small amounts in each pass.
How much?
0.2. And she is already feeling something. It's not a very comfortable sensation. Okay, my needle is there. I stop injecting. Okay? And I'll go down. Again, make a fold, because every time you go lower on the neck, it will be less volume. Feel the needle, it's really there. Just pull it a little bit back and go deeper. How can you handle the needle for such a long distance, a flexible one, with the position of the syringe? If you want it to go superficial, you have to turn it like this. If you have to go deeper, you do like this. Then it bend it in a concave way, in a convex way, it'll go deeper. In a concave way, it'll go superficial. And then start injecting again. Okay, just more, a little bit more. And I'm going to use the whole vial here on this side. Yeah. And what happened? Do you inject more up or down? What do you think? It will come down. It will come down. Gravity will pull it a little bit. Diffusion will be in that area, okay? And very, very small amount. Now the thing that I left for the final touch will be here, the jaw. And here, I'm a little bit more superficial, then I just pull it out, and I'll go deeper. See how I do it with the syringe? It's too superficial, see it? Get back, make a fold, go in. Still too superficial, go in. If you cannot do it from such a long distance, go from there. And here, I always aspirate it. I'm near a big artery, I don't want to dissolve it. It will be a mess. So I'm okay. And that's it. And if you compare this side to the other one, there's already some erythema coming out. And I was not touching that area, okay? No, the same needle, yes. How you feel? A burning sensation or an itching sensation? Painful sensation. She can't really get what... Okay, let's try to do the same thing on this side. You can put some ice there. Ice is very helpful in this. So this is the rest of the vial. Okay. Okay. Again, this side is not as long as the other side. Yes, she has more fat on the left side than on the right side. Okay. I'm going near. And now I'm going a little bit from there, okay? It's just to change it. And I think now you can see a little bit more of the needle, where it's coming. Okay, I'm okay. This is okay for me. This is bad. This side is better than the other one, Simone. Mm-hmm. Yes, we are getting used to it. That's why. The chin is not the best place to start with, okay, in your practice, except if you have a good experience with chins, injecting. I'm already injecting this area also. And I have no access from up there to down here, so what I do, I'll go again. Sorry? Can I ask you a question, Simone? What is more painful, the needle going in or the injection itself? Both. She's honest. There's another thing I learned with a teacher of mine is when you ask a patient something that you want really an honest answer, give him options. Don't say, you are not feeling anything, are you? That they will be constrained to say, no, I'm not feeling anything, and they are like this, you know. So, okay, it's done. The chin is done, okay?
Dr. Francisco, my question, I know a little bit out of label, but about the buccal area, the bushy pads.
I'm very afraid of going there.
I know.
Very afraid of going there. Why? If you think about from the jaw up, what happens with aging? You are losing fat. You lose volume. The last 6 years, we start thinking differently about volume on the face. We want to keep it. In blepharoplasty, for instance, we're not taking fat out. We're distributing the fat. Actually, we are doing fat grafts to the face. So if someone has a little bit more fat than should do, I try to be very conservative about it.
So if they are looking for prominent...
I'll try to fill it up there, and I left the fat there. Because you don't find many people that are not overweight, with big fat pad, fat pad, too big. But if I have to do something, I'll probably do from inside the mouth also, because it's much more it's easier to go there.